Thank you all for being here for Manage Your Brood Female Throughout Pregnancy to Repeat Breeding with our guest, Dr. Cheryl Lopate, who we are welcoming back for part 2 of this 2-part event. So today we're going to be focusing on breeding healthy puppies, beginning with providing optimal care of a brood female throughout pregnancy and lactation. Dr. Lopate will provide a review of whelping box considerations to help you set up a dam so she can provide excellent care for her neonates. And together we'll also discuss pregnancy tips on deworming and nutrition of the brood female, as well as considerations on when to breed again. So in case you missed part 1 of this talk, you can find the recording at the link we'll drop in the chat right now, so you can watch that after this. And as always, we're really excited to partner with Purina to bring these events to you, and we are so grateful to work with them to bring events like this to life. So please continue doing what you're doing, which is telling us what topics you want to see covered in future webinars. We are well underway for planning for 2025, so let us know what you've loved this year, what you want to hear more of, what we haven't touched on before that you'd like to learn about, because it is so helpful for us to hear what you're looking for from these presentations. During the Q&A section, we are going to be prioritizing those previously submitted questions as usual. So if you have those questions that you want to ask live, please use the chat to do so as well, and we'll try to get to those too. And before I pass things over to Dr. Lopate, I just want to share a little bit more about Good Dog for anyone who is new, who's joining us. Good Dog is on a mission to build a better world for our dogs and the people who love them by advocating for responsible dog breeders, educating the public, and promoting canine health and responsible dog ownership. We're a secure online community created just for dog breeders to connect with serious, quality Good Dog applicants to find forever homes for your puppies. We use the power of technology to help good breeders level up their programs by providing them with tools like our secure payment system to protect them from scams, and our software to post your available litters and start connecting with applicants from all across the country, as well as a number of free educational resources just like this. We host about 2 webinars every month. We have a number of recordings that are available as well. We also have online courses, articles, tons of health-related discounts, and more, all really to help your breeding programs thrive. So if you're not yet a member of our community, we would love to have you join us, and you can apply to join at gooddog.com/join. And I just want to quickly share a little bit more about Dr. Lopate, who we're welcoming back again today. Dr. Lopate completed a master's degree in reproductive physiology and her veterinary degree at The Ohio State University. After residency in comparative theriogenology at Purdue University, Dr. Lopate became a diplomat of the American College of Theriogenologists. She continued at Purdue as a clinical instructor for 2.5 years. During this time, she spent 6 months on sabbatical in Queensland, Australia, working at an equine and small animal referral practice. Dr. Lopate opened her Reproductive Revolutions referral practice in Portland, Oregon in 2003, and merged the practice with a general companion animal practice in 2011. She has a special interest in ultrasonography during pregnancy, high-risk pregnancy, and male infertility. Dr. Lopate lives on a hobby farm with a Pembroke Welsh Corgi and an Australian Shepherd, a small flock of sheep for the dogs to herd, a Cleveland Bay gelding, 2 donkeys, and a barn cat, of course. So with all of that, I'll pass things over to you, Dr. Lopate, to get the presentation started.
Thank you very much, and I'm glad to be back. I want to thank a Good Dog for inviting me to do this talk. I love doing continuing education for breeders. Just so to clarify, we did do nutrition and deworming in the first part of the this talk series, so we won't be covering that again today. But today we're going to cover preparing for delivery. We're going to talk about normal labor. We're going to talk about some common postpartum disorders, basics of neonatal evaluation and how to monitor neonatal health in the first few weeks postpartum. And then we're going to finish up with when to rebreed, how to make those decisions, and when to spay our intact females. So we'll start with preparing for delivery. And in a minute, we'll talk about getting the whelping room set up. But One of the things that we commonly will monitor in the week or so prior to the bitch delivering is her temperature, and we're watching for a drop in her temperature to tell us that labor is impending. That drop in temperature occurs because progesterone is a thermal hormone. It increases the body temperature of the bitch by about 2 to 2.5 degrees during pregnancy. And so the brain kind of gets a reset on what normal temperature is by having progesterone around, and it adjusts to that. And then when the fetuses are mature, they will release cortisol and they cause progesterone to drop, usually abruptly. And that drop in progesterone causes the temperature to drop. And it takes about 8 hours for the brain to figure out that, hey, my temperature is now too low and I need to reset my little clock inside, my little thermometer inside, and bring the temperature back up. So in order to catch this temperature drop, we need to be monitoring bitches every 8 hours. We typically recommend starting about a week before the bitch is due to whelp. If you're not checking them every 8 hours, it's easy to miss the drop. We do see false temperature drops due to feces in the rectum. And so if the thermometer goes into feces, it might not be the actual core body temperature. And then the other potential cause of a false drop is gas, because late pregnant bitches tend to be very flatulent, as anyone who has had a pregnant bitch knows. And so that gas doesn't hold the body temperature correctly. So sometimes it'll seem like you're having a temperature drop, and then it will, next time you take the temperature, it's back up to a normal range. And so I always tell people, temperature drops are great in hindsight. Temperature drops and the bitch goes into labor in 12 to 36 hours, then that was probably a real drop. If the temperature drop happens and the bitch doesn't go into labor, then maybe it wasn't a real drop. Normal temperatures are going to be about 1.5 degrees lower in the morning than in mid-afternoon. And so usually around 99 in the morning, 101 to 101.5 in the mid to late afternoon, and then it's going to start to drop down again as their activity level tapers off. We expect a temperature drop to be into the usually 97, sometimes 96 range, and then again quickly come back up. Some reasons why temperature won't drop are bitches that have a very slow decline in progesterone as they're coming to term. So if a bitch is, 5 days out and her progesterone is 2.5, and then 4 days out it's 2.4, 3 days out it's 2.2, 2 days out it's 2.1, 1 day out it's 2, and then that's 2 is kind of that critical point where labor is going to begin. So when they have those slow drops, sometimes temperature only drops very minimally. And so we won't see that temperature drop. And then also with small litters, single puppies, or in giant breeds, sometimes 2 puppy litters don't get enough stimulus from having such a small litter to cause the cascade of events that causes progesterone to drop to occur. And so these guys, their progesterone doesn't drop, and so they don't have a temperature drop even though they are overdue. All right, so let's talk about getting set up for our bitch going into labor. We want to get that whelping room set up and ready to go at least a week prior. And we want to move the bitch into that area. If she's going to be moving locations, we want to get them there a week or 2 prior to their due date so they have time to settle in, get used to their new surroundings, get used to the new people, if there is a co-breeder that they're going to whelp with. Get used to the new feeding regimen, all those things, so that they're settled and relaxed by the time they're ready to go into labor. We want to make sure that whelping room or area is a quiet area, preferably with the ability to dim the lights, so that if we have a stress situation for the bitch, we can make it more of a den-like environment, so a darker environment. We want to make sure that it's away from all other animals and human activity. We don't want to put the whelping box in the middle of the living room or the family room where everybody is sitting around watching TV and they're having dinner and those types of things, because all that activity is very stressful for the bitch in the first couple of weeks when the puppy's eyes and ears are closed and they're trying to be the protector of the litter. Room temp is something that's really critically important, and it's a big mistake that we see with a lot of breeders, especially novice breeders. Room temperature should be about 70 degrees Fahrenheit and about 70% humidity. In most places, probably other than like tropical places or the southern United States, 70% humidity is something we have to kind of work to create in our houses. And so a humidifier running or a couple of extra water bowls in the whelping room to pull moisture into the air. And then we just don't want that room to be all that hot. The room should be comfortable for the humans to be in and for the bitch to be in. That's going to be about 70 degrees. The whelping box should be at least 1.5 times the body length of the bitch so that she has room to lay down on her side, stretch out and relax, and have enough room in that box to do that comfortably without having to be kind of torqued around or rounded up, and so that the puppies have enough room to spread out in the box as well. We want the whelping box to be of a material that's easy to disinfect. That's going to be something like metal, like this box here is, or it can be some type of impervious plastic or sealed wood that's going to be easy to disinfect and clean up. We usually will have most boxes are going to have pig rails on them. That's this little shelf here on the side of the box. And the pig rail should be the height of the pig rail, and the distance of the pig rail should be the distance from the middle of the bitch's spine to the floor when she's laying on her side. That's how tall it should be. And then it should be the width of a puppy of whatever breed you have, so that a puppy can lay comfortably underneath this pig rail. And the point of the pig rail is that if the bitch lays down and you have a puppy sitting behind her back, that it's going to get pushed under the pig rail, but the bitch can't actually crush the puppy because the pig rail prevents her from getting her back right up against the wall. So that's the goal of the pig rail. Sometimes we'll have bitches, especially toy breeds, often we'll put them into crates, and those guys won't have pig rails, or wading pools or a common whelping box because they're easy to clean. And they're portable. Those don't have pig rails, but it's certainly preferable to have them. It's safer for the puppies to have a pig rail in their box. And then we want to have a temperature gradient in that box from 85 degree in the first week, 85 degrees at one end of the box, 75 degrees at the other end of the box, so that puppies can gravitate towards the heat if they want it, then gravitate away from the heat if they don't want it. And then we generally drop the temperature gradient in the box 5 degrees weekly until the third week, which is when we're going to usually move them into some type of play area, exercise pen, something like that, where they're going to start interacting with people and having more interactions with objects. So I always tell people a happy whelping box is usually a couple of puppies, 2 or 3 puppies that are in a small pile together and kind of spread out around the box. If all the puppies are underneath the pig rails at the edges, that means it's too hot. And if all the puppies are in a pile or they're always constantly laying underneath the bitch or against the bitch, then they're too cold. Whelping nests are really nice. They usually, you just purchase a nest, and it's just a piece of plastic, coated plastic that has a rheostat or a heating board attached to it with an adjustable temperature. You build your whelping box around this nest, and then you just drop your nest into the box. You set your temperature from underneath, and then as the weeks go by, you just lower the rheostat temperature. They're really nice. So this is a whelping nest in a box, and you can see that the bitch gets to lay on the cool surface away from the heat, and the puppies lay inside the nest. And the bitches quickly learn how to kind of present their mammary glands to the puppies around the nest. They'll often lay kind of in a curl this way, and the puppies will just hop up there and nurse, and then when they're done, they fall asleep, and the bitch can get up and walk away whenever she wants to. So really nice. I think that's probably the best type of whelping box is to have a whelping nest. So if you're planning on doing multiple litters, it's worth the investment to get that whelping nest and build your box around it. We're going to need some kind of heat source in our box. That can be any variety of different sources, might be heating pads or boards. Most of our newer heating pads nowadays, human heating pads have a set amount of time that they will stay on, and then you have to reset them. So you can get some heating boards that can be plugged in and will just stay at the temperature, like an 80-degree temperature all the time. And so those are good, but if you have one that needs to be reset, you just need to be very conscious of the time. Set alarms so that you remember to go back to the box, turn it back on again so that the puppies have a heat source, because they're completely dependent on their environment for temperature for the first 2.5 weeks of their life until they are up and ambulatory. You can do heat lamps in a box as well, and put a heat lamp at one end of the box. Red heat lights are better than white heat lights in terms of the type of radiant heat that they produce. But if you're using a heat lamp, then what I usually recommend is that you are somehow monitoring the temperature at the level of the puppies under the lamp and at the other end of the box. So that can be something like a terrarium thermometer that you can stick one on every side of the whelping box, so you know what the temperature is at the level of the puppies all around. Some people will use a thermal gun or a thermocouple to measure temperatures. Any way that you can monitor temperature, but you have to be a little more careful with heat lamps. Puppies can get overheated if they get underneath them, especially if you have a puppy that's fading. They don't tend to gravitate towards or away from heat very well when they're not doing well. And so we need to be a little more careful with our heat source when we have puppies that are not doing well. The whelping nest is a great heat source. There are these little discs, they're called snuggle safe discs, and you throw them in the microwave. There's all different kinds of varieties of these types of things. This is a hard plastic one. They have them that are soft and they have gel inside. You throw them in the microwave for a set number of minutes, and then they stay warm. A lot of these, like these little snuggle safe discs, they'll stay warm for about 8 hours. So they're nice, especially for toy breed litters. You can just throw one of those under a blanket, and it gives them a good heat source. We always want to be sure that we're protecting our puppies from the direct contact from the heat source, because puppies love to burrow, and they burrow towards heat. So if you just kind of lightly throw a blanket over the top of a snuggle safe disc or a heating pad, or even the heating pads that have those little soft cloths on one side and they have like a snap on the other side, puppies will, climb in underneath the between the cover and the heat source itself, and their skin is very, very thin on their pads and on their abdomens, and they can have a thermal burn from a heat source. Even if it's something that we can put our hand on that doesn't feel that hot, a puppy will have its skin burned. So always be sure that they're protected. We want to do everything that we can to reduce the stress level for the bitch. So one thing that I encourage all breeders to have is to have a DAP, or dog appeasing pheromone diffuser, in your whelping room. They used to be called Adaptil. Now they have been bought out by the Thunder Shirts company, and so now it's called Thunder Ease. And they are just like a room freshener. They have a little month diffuser. You plug it into the wall, and it just keeps the room perfused with this calming pheromone. And they work actually very, very well. So they're very effective. So I encourage that. having the ability to have classical music playing for in the whelping room is a great way to calm bitches, to be able to dim your lights. And then oxytocin nasal spray is something that we use in nervous maiden bitches, or we use it a lot for after our elective C-sections on maiden bitches, so they don't really know what the puppies are. They have this C-section and they wake up, and then all of a sudden there's these little creatures that are making noises and trying to suck them. They have no idea what's going on. And so oxytocin nasal spray is something that's pretty easy to get. The original studies were done in pigs, and they used a lot more concentrated or higher amount of oxytocin. But I have found anecdotally that using our regular oxytocin that we all have in our clinics, that we use for our medical management of dystocias, in a nasal spray bottle, and then giving bitches a puff of that into their nostril every time that they feed, so every 2 hours, and then alternating nostrils each time, so that we're basically, the idea behind it is that you are coating the cribriform plate, which is at the back of the nasal passages, and that's where all of the pheromones go in animals, to tell them, oh, a bitch is in season, or I should be nervous. All of those types of pheromones go back to that cribriform plate. And so the oxytocin coats the cribriform plate and tells the brain to be maternal. And so it enhances maternal behavior in bitches that really are nervous or anxious, don't know what they're doing, or are struggling to be good mothers. And then there's always medications that can be used to try to help calm bitches that are really struggling with anxiety. We often see these things in like large kennel situations where whelping rooms are shared by multiple bitches. Those are very stressful situations. Or in kind of high-strung bitches that had an elective C-section for whatever reason, and then have to deal with their puppies. So acepromazine is a good medication. Not only is it a sedative, but it also increases mammary development and thus milk production. And then we can use trazodone, which is safe for use in lactating bitches, or gabapentin, which gives us a little bit of sedation. And sometimes that's a desirable trait of the medication that we're using. So anytime we're using a sedative drug, we want to be sure we're monitoring that bitch to make sure that she's stable on her feet, she's careful where she's laying down, and that she's not having especially if you've never used it before and we're using something like trazodone, sometimes they can get a kind of an idiosyncratic reaction where it's supposed to be an anti-anxiety, but it actually raises their level of anxiety. And then we get kind of aggressive behaviors. So you just want to be careful if you've never used it before on your bitch, to make sure that they're having an appropriate response. So we're briefly going to talk about normal whelping. And we see whelping occur in three stages. Stage 1 is the preparation for delivery. It's when we're going to see relaxation of the pelvic ligaments, relaxation of the vaginal canal and the cervix, in preparation for delivery. It can be as short as a few minutes, 30 minutes to an hour, and as long as 36 hours in some bitches. And it tends to be longer in maiden bitches than in our multiparous bitches, the ones that have had multiple litters before. And so once you have the rupture of that first allantoic membrane, the water sac breaking, that is the start of stage 2. And stage 2 is delivery of the fetuses, and stage 3 is expulsion of the fetal membranes, or what we would call the placentas when they're inside the bitch, fetal membranes once they're expelled. And the stage 2 and 3 happen usually simultaneously. There'll be a couple of puppies delivered, and then a placenta or two, and then some puppies and placentas. And usually you don't get all the puppies delivered and then all the placentas. They usually are it's an interchangeable situation. And the length of stage 2 and 3 really depends on litter size. So small litters where there's only a couple puppies is going to be a pretty short delivery time. And in litters that have 16 puppies, those are going to be, 15, 18, 24 hours to get all the puppies out. The fitness or the body condition of the bitch. So the more exercise the bitch gets during her pregnancy, the better she's going to be able to whelp. Whether the bitch has any health issues, like she has a concurrent uterine infection, she had gestational diabetes or pregnancy toxemia, and her body condition is poor. She has, some other type of metabolic disease that she develops during pregnancy. And then whether the bitch develops uterine inertia or that uterus fatiguing prior to completion of delivery. Puppies are delivered both head first and feet first. Head first about 60% of the time, feet first 40% of the time. Both are completely normal. And usually it can be anywhere from a couple of minutes between puppies to up to about 2 hours. And usually at 2 hours, we believe that we should be starting to intervene if that bitch is not working on the next puppy. They can certainly go longer and not have problems. But the longer that they go, the greater the risk that you're going to start to have some placental separation, and that's going to result in fetal loss, especially as you get further and further along in the delivery. We do see that bitches tend to gap out in time as we get close to the end of delivery and the fetuses are up at the tips of the horns. And that's because after each puppy is delivered, that uterus has to shorten down and bring then the next fetus in line close enough to the pelvic canal that the umbilical cord is going to stretch and stay attached while that puppy is being delivered. So clearly, if you have 10 puppies in a litter and you got 5 puppies in the horn, that last puppy is going to take a little bit longer to get that uterus to shorten up so that it's close enough to the pelvis for her to be, for it to be delivered, and still have an oxygen supply. We do sometimes see that puppies that are in posterior or a feet first presentation may take a bit longer. If it's the first puppy that's being delivered feet first, that's the smallest part of the fetus is the hind end, and then the rib cage is bigger and the shoulders are bigger still. And so the birth canal has to stretch as that first fetus comes through the pelvic canal. And so if the smallest part of that fetus is coming through first, it takes a bit longer for things to stretch than if they're coming head first and you've got the biggest part of the fetus that's pushing through that cervix and the vaginal canal at the beginning. And then the other part of posterior puppies is that the hair is kind of going against the grain. So the hairs are, usually moving from the head to the tail. And so when they're coming backwards, it's kind of like lifting those hairs up. And if the water sac, that inner water sac around the puppy, the amniotic sac breaks and the fluids get away from the puppy and it gets a little dry in the birth canal, it's almost like that puppy is kind of Velcroed in and the bitch has to work a lot harder to get them out. So sometimes adding some lubrication will help with that effect. One thing that we use for a lot of bitches for whelping is called WhelpWise. It's a telemetry system, and we basically have this little telemetry unit here. It's got a belt that goes around the bitch's abdomen. The data from what's happening in the uterus gets sent into this little unit, gets plugged into your phone, and then gets sent to Colorado, and they get a tracing that looks like this. It tells us what the contraction pattern of the bitch is, how long the contractions are, and how strong they are. And so we can see that, here we have a contraction that lasts, each of these little numbers is a minute. So lasts about 5 minutes, and it's pretty moderate in strength. And then she has a break of about 3 or 4 minutes, and she has her next contraction, and then a break of about 5 minutes, and she has her next contraction. So it's a nice, good pattern there. Versus this bitch that has kind of a very short 2-minute contraction, just kind of sitting at baseline, hovering at baseline, a little bit of irritability, not really a great contraction at all. And then she goes about 15 minutes. and she has this little blip and then kind of just some irritability, not really a good contraction. So this helps tell us, do we need to give this bitch some calcium? It also lets us know if the bitch is having, really big contractions really frequently without a lot of time in between. That's an obstructive pattern. So it lets us know we need to get this bitch in to the vet clinic for emergency evaluation, possible C-section, and that if we know that, sooner rather than later, that gives us better puppy survivability. The other thing that Whelpwise sends with their units are these little Dopplers, so we can monitor fetal heart rate, and even if the bitch is delivering well, we can pick up on fetal distress sooner, and again, get them into the clinic faster for a better outcome. So fetal membranes, I think it's important to try to keep track of them during delivery. We try to not let bitches consume fetal membranes. They really just cause GI distress, sometimes vomiting. I've seen a couple bitches choke on them. They almost always cause diarrhea 24 to 48 hours post-whelp if they consume a lot of them. And there is really no maternal benefit to consuming the placentas. They don't bond with their puppies because they eat the placentas. The only reason that they instinctually do that is because it's a way to clean up the environment so that predators don't know that they just had a litter of puppies. So in the wild situation, the bitch is going to be whelping in the den, and if the fetal membranes came out and she just left them laying around, they would start to rot and they would cause a lot of odor. And that brings the predators in because they smell that decaying tissue that they see as food, and then are going to try to come into the den to attack the puppies. So the bitches eat them to try to be protective, and it's just an instinctual thing that they still have ingrained in them, even though we've had them domesticated for a really long time. So there's no reason that they should eat them. But sometimes they do. It's not a big deal if they eat one or two, but we just try to not have them eat all of them to try to help reduce GI distress. We don't really do anything. I don't really do anything if they have retained fetal membranes. Every single time that the puppies nurse, they are causing oxytocin to be released from the bitch's brain in order to cause milk letdown. And that oxytocin at a normal physiologic level will cause the uterus to contract and involute, and the remaining fetal membranes will detach and they will be expelled either entirely, or if it's more than 24 to 48 hours, they kind of degrade and they get expelled in the lochia. So, and that's the discharge that the bitches produce after whelping. So it's not really a big deal. I don't give clean out shots, never have. And we don't find that bitches that retain fetal membranes for a few days are at any greater risk for getting uterine infections than bitches that pass all of their fetal membranes. All right, so delivery of the fetuses. Once you have a fetus delivered, if the amniotic sac, the second sac, the one that's around directly around the fetus, hasn't broken, we want to break that quickly so that the puppy has access to room air and can breathe. We want to use some type of suction device. There's small bulbs for little tiny puppies, big bulbs for bigger puppies. Want to suction the nose and mouth out. We want to get that puppy dry and warm as quickly as possible. The bitch may start licking the puppy and kind of pushing it around to stimulate it. And we are going to do the same thing. Normally, bitches are going to lick the backs of the puppy's heads. They might pick the puppies up by the scruff and carry them around. That's a stimulus to them, and they lick them in their inguinal areas. So those are the areas that we should concentrate on if we are stimulating puppies. So pinching the scruff, rubbing them in their inguinal area, and then getting them warm and dry as quickly as we possibly can. They do have a lot of surface area, and they go from being at 100 degrees inside the bitch to 70 into a 70-degree environment. And so they chill very quickly. And when they get cold, that slows their heart rates and their respiration. So we want them dry and warm as quickly as we possibly can. If the cord didn't break during delivery, then we want to put a clamp, a hemostat clamp on the cord, and then we're going to tie it off on the far side of the clamp. So leaving the clamp in place and you're not as below it or away from the puppy, away from like towards the feet. And most people are going to use either thread or dental floss to tie those off. The umbilicus is going to fall off in a couple of days, so it doesn't have to be anything sterile. And then especially if the cord breaks naturally on its own, we want to swab the end of it with a iodine solution so that any bacteria on the ends of the vessels are killed, and they can't ascend up the umbilical cord vessels into the abdomen of the puppy to cause infection. We don't want to swing puppies. We used to swing puppies all the time during resuscitation, but we don't do that anymore. It has been shown to cause brain injury in puppies. And so we don't swing them. We like to use just hand stimulus and mouth to snout ventilation. So placing arm mouth over the puppy's nose and mouth and breathing for them until you can feel the chest expand. There's an acupuncture point on the nose of the puppy. It's called GV26, and the point is on the center of the nasal planum, or the nose itself, anywhere between the level of the nares and the point where the hair and the nose meet together. So depending on your breed, sometimes this is kind of a big wide gap, and sometimes it's a tiny little space. And so we want to put that needle in there. We use little acupuncture needles, or if you don't have an acupuncture needle, you could use like a 25 or a 27 gauge hypodermic needle, and you just push it in to where it touches the bone and then twirl that little needle. We try to use short ones so that we can keep that needle in place and do mouth to snout ventilation while that needle is in. And then we just, every few breaths, we're going to twirl that little needle to stimulate respiration. And so you can see we have these puppies in towels, and if a puppy is not breathing well on its own, we're going to be breathing for it. We don't worry about clamping cords until the puppies are going well. And then stimulating the ones that are doing well and getting them nice and dry. All right, so reasons to call the veterinarian while your bitch is whelping. A bitch that's gone more than 2 days past her due date on a breeding that has been well timed with progesterone testing, or more than 72 days from the last breeding, would be a reason to be at least having an evaluation by your veterinarian. More than 4 hours from the first water sac breaking to the first puppy being born. More than 2 hours between puppies. Any significant amount of green-black discharged before the first puppy is born is a reason for concern, especially if it's a large amount or it's increasing in amount. We do sometimes see light green or olive green, forest green discharge in small amounts before the first puppy, and we don't worry about that so much, but the green-black stuff is an indicator that a placenta is separating before a puppy is being delivered. And so we want to, that is a reason for us to be concerned. Once the first puppy is born and that first fetal membrane comes off, we can't differentiate that fetal membrane from any of the rest of them. So we only look for green-black before the first puppy, and after that, it's not an indicator of anything abnormal. Any significant amount of bright red blood at any time during labor is not normal. We often see dark blood during delivery, and it can be quite voluminous if it gets mixed with the fluids. But bright red blood that's dripping from a bitch is a reason for a phone call. It often indicates that there's been a tear either in the vaginal canal or the cervix or the uterus. And we want to get that addressed quickly if it's happening. Any signs of abdominal pain or distress in that bitch would be a reason for veterinary consultation. And then distracted mothering is when you have a bitch that all of a sudden doesn't really want to, she's been a good mother, she's been attentive to her puppies, and all of a sudden she's stops wanting to clean them, or she doesn't want to get back in the box with them, or she starts to growl at them as they approach her to nurse. And that is something that can happen anytime from whelping until weaning, and is usually caused by low calcium. So that would be reason to consult your veterinarian as well. All right, we're going to talk a little bit about postpartum care. I'm just going to cover the three most common things that happen postpartum, and we're just really briefly going to cover things. It's a whole nother talk to talk about these diseases, but we want to monitor temperature, attitude, and appetite of the bitch after she whelps. During the first week, temperatures up to 103.5 are normal. Uterine involution is an inflammatory process, and so it's very common for bitches to have a low-grade fever. But if they are feeling well, they're eating, they're drinking, they're mothering their puppies well, and they have these temperatures, not a reason for concern. If they have these temperatures and they're not mothering well, or they're not eating, or they seem depressed or lethargic, then it is reason for concern. During the second week, temperatures up to 102.5 are not uncommon, and that's just because they're laying in the whelping box where it's warmer, and they have these puppies, constantly around them, which are going to increase their temperatures. We want to keep an eye on bitches for signs of mastitis, red, firm, painful glands, or bitches that have discolored milk twice a day. Signs of mastitis might be fever, unwillingness to let the puppies nurse, growling when puppies approach to nurse, or bitches that when they get up and they walk around seem like they have a very stiff, stilted gait. Most of the time with mastitis, you're just going to see kind of a red, firm, swollen gland, but we do sometimes see bruising, and these are much more severe and significant mastitises. When we see these bruises appear on the bitches, it usually means that it's a very toxic bacteria that they have, and there's an abscess inside the gland that can't get to the teat to be expressed out or nursed out. These will eventually, you can see, like, here's a little dot of fluid and a little dot of fluid. We've already got serum kind of oozing out of these glands as this tissue is dying. And eventually, if we did nothing, all of this tissue would just slough out and leave a big, huge hole here. And basically, that's what we will do if we see these, is we'll open these abscesses up and remove as much necrotic tissue as we can. But if you have a typical case of mastitis, we want to, it's always best to culture the milk, so that if we don't choose the right antibiotic for these guys on the first go around, that we have a culture pending to tell us what would be our second choice of antibiotics to use. And then we want to warm compress the mammary gland as frequently as possible, every couple of hours, and then follow that up with a cold cabbage leaf compress. And that cabbage leaf has some chemicals in it that helps remove fluid from the gland, so it's easier to milk out and soften up. In most situations, it's okay to let puppies nurse the mastitic gland, and puppies will nurse out a firm gland much, much better than we can when we hand milk them. So we encourage people to have puppies nurse the gland. The caveat would be if you have a bitch that has that's septic, so she's very, very sick with a toxic mastitis or an abscess, and then we generally, those toxins can be bad for the puppies. So in those cases, we'll get the puppies off until we get the bitch's physical condition back under control, and then put the puppies back on. Metritis is a uterine infection after whelping. It's not a pyometra. Pyometra happens during the progesterone phase of the cycle. Metritis happens after they whelp. It's usually unrelated to retained fetal membranes, and it's due to bacteria getting in the track up the reproductive tract, so from the vagina into the uterus, and then they go into the placental sites and get into the bloodstream of the bitch. These bitches usually present with fever, lethargy. They usually have a very, very, very foul smelling vaginal discharge. These cases can be very, very severe, and bitches can get very sick and sometimes die from these infections. So you want to get them addressed quickly and get the bitch on appropriate antibiotics, fluid therapy if she needs it, depending on her level of dehydration and illness. Most of the time, if we have puppies nursing, we don't need to give ecbolics or drugs that help the uterus contract, because again, oxytocin is being released every time the puppies nurse, and that will cause the uterus to contract and help get all the bad fluid out of the uterus. But if we have bitches that are hospitalized and the puppies have been removed, then in these cases, we may want to use either oxytocin if it's very early postpartum, or some type of prostaglandin or misoprostol, something like that, to help the uterus contract to get rid of the discharge. These bitches are going to go on broad spectrum antibiotics, and again, we want to culture that discharge so that if we chose the wrong antibiotic, we have a better choice in a couple of days to switch to. And then the last one that we're going to talk about is eclampsia. Eclampsia is a low calcium level, and it can occur kind of as a very mild case to a very, very severe case. We tend to see the most severe cases in our toy breeds, bitches that have very, very large litters, and especially bitches that have large litters that are in poor body condition. So these are often bitches that had pregnancy toxemia, gestational diabetes, and so they've been struggling to eat during their pregnancies, and they've gotten really, really thin, and they just can't mobilize their calcium stores properly. Early signs of low calcium, facial itching is one of the most common things. So bitches kind of pushing their faces around furniture, around the whelping box, scratching at their faces with their paws, and poor mothering behavior. And then as calcium gets lower and lower, we start to see the effects of not having calcium inside the cells. And that's going to start with some muscle fasciculations and trembling. This facial grimace, which you can see in this bitch up here, she's got tetany here. Her legs are straight out. She can't bend her legs, and her face is kind of pulled back in this grimace. Which is very classical of severe eclampsia. And then if we don't recognize that they have it at this point in time, they will eventually progress to seizures, and then we'll start to get hyperthermia and sometimes heat stroke. So the best way to diagnose these, of course, clinical signs, if they're severe like this, they're pretty obvious, but in the earlier stages, where calcium levels are kind of borderline, an ionized calcium is better than a blood calcium, a serum calcium level. And then they're going to be treated with some type of calcium, either subcutaneous if it's mild, to intravenous if it's more severe and they're having the types of tetanic seizures or muscle fasciculations. We'll start with IV calcium and then switch them to an oral calcium supplement after that. We usually will start by removing the puppies until we get calcium stabilized, and then we'll try a slow reintroduction. A lot of times we can get the puppies back on, but maybe they won't be able to nurse every single time that we would like them to, and we'll have to do some supplementation. But if we see eclampsia relapse after the puppies have been returned in kind of a slow format, then we're just going to wean the puppies and feed them supplementally. So poor mothering behavior and poor appetite is something that we see commonly in bitches. We see it in new mothers, maiden bitches. We see it in bitches that tend to be kind of the more high stress, high anxiety bitches in general. After they whelp, they will get more so. Bitches that have any type of pain, either from a C-section or from a long, difficult delivery. And then any type of problem with our environment. It's too hot in the room. There's dogs that are standing with their heads over the baby gate, staring in the whelping room. Or we have, people coming over to see the puppies all the time, and everybody's picking the puppies up and handling them. And then sometimes with low calcium, we'll see this poor mothering behavior as well. And so we have to differentiate low calcium behaviors from other environmental conditions that will cause poor mothering behavior. You should never supplement calcium without some type of veterinary support to help you make decisions about whether this bitch is truly hypocalcemic or whether it's environmental. Because the more oral calcium that we give, the greater the risk that that bitch will become hypocalcemic, because she's not going to mobilize her calcium stores quickly enough when she hits peak lactation at 2 weeks. Things that we can do to help bitches: feed them in the whelping box, give them tempting foods, the canned foods, or boiled chicken, boiled hamburger, those types of things. It is important to remember that water is the most important thing for lactation. So we sometimes see that in the first week, bitches are just kind of very attentive to their puppies. They don't want to eat, especially if they're in a situation where there is some stress around them, noisy environments, other dogs, things like that. They may just want to just be paying attention to their puppies. And as long as they're doing well and they're drinking, they will continue to lactate and use their body stores for energy, and that's okay. Bitches in the wild that have puppies don't leave their den for 2 weeks. Until the puppy's eyes and ears open, they are going to sit by their puppies. They choose a den that has a water source nearby. They basically just walk right outside their den to urinate and defecate, and then are right back inside. So they're not eating for the first 2 weeks. And while we don't really want our domesticated bitches to do that, it is okay when they are not eating well for the first week postpartum, as long as they're drinking okay. So if they're feeling well, they're mothering well, and they're just not eating great, that's okay. If they're sick, then that's a different story. We should be intervening. Some bitches will get gastric reflux during or after whelping, and they will do really well to get them back on their food by giving them a dose of famotidine or Pepcid or omeprazole, which is Prilosec, a couple times a day, and then that's all that they need to get them back on their food. And then again, looking for environmental factors and making changes to their environment, plugging in a DAP diffuser, giving them a more den-like situation will often get that mothering behavior and appetite back on track. Okay, we're gonna talk about neonates here for a few minutes. Normal neonates are gonna have mucous membranes that are bright pink in color, and their tongue, and a healthy neonate is going to be in this very kind of sharp, thick V shape. So when this puppy is born, it should look like that. Nice, really, really bright pink, and this thick tongue that is in a V shape. And something that I often ask people if they're at home and they have a puppy that they're struggling to resuscitate is, what does the tongue look like? Because if the tongue is less bright pink and it's kind of flat at the bottom and just the edges are curled up more like in an elongated U shape, those puppies are not perfusing well. This puppy in this picture is perfusing really well. So it's getting good blood flow to its head and its brain, and it's vocalizing, doing well. So we want to look for that bright pink color. We want to see movement and vocalization of puppies. Basically, from the time they're delivered, they should come out squawking. And if you stimulate them, you pinch their scruff or you rub their back, they should move away from you. We want to check all puppies from the get-go for a cleft palate or a hair lip. Cleft palates look like this down here, where we got the tongue pulled down. We're looking at the roof of the mouth, and there is this big, wide open kind of V shape in here. This puppy will not be able to suckle, and we'll have to have major surgery if we're going to bring it to adulthood. So this is something that should be checked right away when puppies are born. This puppy over here has a hair lip. You can kind of see there's kind of this V shape in the at the nose instead of this straight line that we have over here. And so this prevents them from being able to latch and get a good suckle. But this is really just a cosmetic problem, whereas this is an anatomic problem that's going to be trouble for this puppy as long as it lives until that palate is repaired. We want to check the umbilicus and the anus. Make sure that the puppy has an anus. The puppy can urinate normally and is able to defecate normally. Sometimes we have problems with these things. We want to check the head shape of the puppy. This is kind of an extreme case where you have this very big domed fluid pocket on top of the head, but a lot of times we'll see kind of an irregular dome shape to the head that's associated with hydrocephalus. And then we want to check the legs on the puppy for any abnormalities, either a missing part of the appendage, or like in this case, we see that this puppy has no hair on the end of this leg compared to this leg, which is normally haired. We want to monitor puppies, weigh them twice a day for the first 2 weeks, and then once a day for the next 2 weeks. Failure to gain weight on a daily basis is the best indicator that you have a puppy that is starting to fade. We should see a minimum of 8 to 10% weight gain daily, and up to 20% daily is normal for the first 2 weeks, and then that's going to start to decrease as they get older. We want to pay extra attention to puppies that are not gaining. So whether it's a single puppy in a litter that's not gaining, or the entire litter is not gaining. If the entire litter is not gaining, we would be looking at how is that bitch producing milk. Is there a problem with the bitch's milk if she seems to be producing enough of it? Are the puppies sick in any other way versus a single puppy that might be a small puppy, or maybe has a cleft palate that didn't get noticed, and that puppy acts like it's nursing, but it's not actually able to nurse. We try to give puppies that are struggling to gain some private nursing time, pull all the puppies off, let the mammary glands fill up for an hour, and then give those single puppies the back 4 teats. They have the most milk and the easiest milk to attain by sucking. Puppies should nurse for about 15 to 20 minutes every 1 to 2 hours. And puppies that are nursing constantly, we never see them let go of the teat. They nurse, nurse, nurse. They fall asleep for 5 minutes. They wake up. They nurse, nurse, nurse. Those puppies are either not nursing effectively, or they've got some type of anatomic issue that's preventing them from nursing. Supplemental feeding, there's lots of different ways that we can do it. Tube feeding is going to be the fastest and probably the safest way to supplemental feed. You just need to be trained how to do it. It's very safe if you've been trained properly. Bottle feeding can be done with an appropriate sized nipple. That's probably the biggest problem that we see with bottle feeding is that people will try to use these little pet nursers with a puppy that's larger than 2 or 3 ounces. They simply can't get this nipple back to the latch point in their tongue. And so we tend to use human baby bottles. I like the ones that have this 45-degree bend to the neck because you can hold the bottle upright and have the milk be down in the nipple when the puppy is laying in a horizontal plane, which is how we want them to be nursing. And then we use a low flow or a preemie baby nipple, and don't enlarge the opening. We want them to have to work to nurse. If you can't get a puppy to bottle feed, sometimes sponge feeding can be done. It's relatively safe. You want to use a cosmetic sponge, cut it into a wedge, and then you just put a little hole in the end of the wedge, put your syringe with your milk in it, and then you're just going to slowly push the milk into the sponge as the puppy is drinking. We don't want to actually syringe feed puppies ever. It's very dangerous to syringe feed. It's easy to flood the mouth with milk, and then they will inhale part of that milk into their lungs. So we should never be syringe feeding. And when we're feeding, we always want to feed based on the weight, the amount of milk that that puppy should be getting for its weight. We shouldn't just let that puppy nurse until it's binge full and has a big bloated stomach. You know, when they're bottle feeding or sponge feeding, they usually eat pretty quickly, and so they'll consume a lot more milk before they realize that they're full, and we don't want to overfeed them. So we should be monitoring the neonate for activated sleep. Those are the little jigs and jumps that puppies do while they're sleeping. That they should nurse for about 15 to 20 minutes every 1 to 2 hours. Puppies should be vocal only when they're stimulated or when they're going to nurse. Otherwise, they should be sleeping quietly. We want to keep an eye on stool quality and quantity, making sure that they don't have diarrhea. Bitches that are doing a really good job of cleaning up after puppies. Sometimes it's hard to even find poop because the bitches are cleaning it. And urine color is probably the best way to assess hydration in a puppy. Skin tint is not at all accurate for assessing hydration because puppies don't have any sub-Q fat under their skin. And that's how we assess hydration, is how much water is in the fat under their skin. So the best way to look at hydration is to stimulate them to urinate, and it really should be basically clear with a tiny little bit of yellow tint to it. The umbilicus should dry and fall off within 2 to 3 days of being born, and should never be red or inflamed, and they should not be urinating out of the umbilicus after within an hour of delivery. Sometimes we'll have puppies that vocalize after eating if they get a big full stomach, and we can use the human simethicone drops. For that, I usually give 1/3 of the infant dose, and they all come with a little syringe inside. The infant dose is 0.3 mil, so we give puppies 0.1 mil. And usually that's effective in about 10 to 15 minutes. It'll settle that puppy down if it's just gas in their stomach. Just really briefly, puppy handling. We want to minimize the amount of handling that we're doing on puppies for the first 2 weeks of their life before their eyes and ears open. Really, all that we should be doing for handling is weighing them, making sure that they're getting fed and that they're nursing. If they need medications, that they're getting their medications, and that the box is getting cleaned daily. And other than that, we shouldn't be doing much more. We shouldn't be having company over and people holding puppies and cuddling puppies and things like that. The more handling that we do in these young puppies before their eyes and ears open, the higher their cortisol levels are, and it increases the risk that they will be high anxiety or reactive adult dogs. There's some good research that was done in the 1980s by the Army, the Army dog handlers. It's called the Super Dog Program. With things that we can do to puppies to make them better working dogs as adults. And they found that you could do this very quick, about 5 minutes of handling once a day on puppies, and it helped them be easier to train as adults. And so we wanted to hold them in an upright position with their head down, hold them on their backs, flat on their stomachs, and on their sides. And then tickle their feet with a Q-tip, all 4 of their feet, so they don't mind being handled, having their feet handled when they're older. And then take a washcloth, a cold washcloth, and put a puppy on the cold washcloth. And you can see this puppy does not like this place where it's been laid, and it's gonna wiggle its way off of that cold cloth. Learns to be aversive. And so these things they found, if they did these things in the first 2 weeks, 5 minutes a day, and nothing more than, the regular routine cleaning and weighing, that those were the best, easiest to train dogs as adults. After the puppy's eyes open, that's when we want to start doing all the socialization things that we do. Get them around lots of different people. Make sure if people are coming into your home that they are properly disinfected, clean clothes, clean shoes, clean socks, wash hands, all of those things. But get them around all different kinds of people, children, boys and girls, little tiny babies, teenagers, adults, men with beards, people that are wearing ball caps and hoodies, and all the things that dogs are going to see when they get older. We want to use basically the rules of 7, which means they should be exposed to 7 different types of surfaces, 7 different foods, 7 different sounds. And basically, it just means expose puppies to as many possible things as you possibly can in the first 7 weeks of their life before they hit their first fear stage. And then these are things that they will remember as they get older, and they will have less fear about them as they are growing up. We want to vaccinate puppies either based on their nomograph, which we talked about in the last session, or at 7 weeks postpartum. We want to start weaning around 4 to 5 weeks of age, and that should be complete by 7 weeks of age. Even if you're going to keep puppies much, much longer, they should be weaned by 7 weeks of age and be able to eat independently and act independently of their dam. They enter their first fear stage at 8 weeks. So ideally, we'll have them rehome by 8 to 9 weeks, and that tends to reduce the amount of stress that they have with their weaning process. And it's great if you can work on things like crate training, litter box training, and getting in the car and driving around before puppies go to their new homes, rather than the first time that it happens is when they've already entered their first fear stage. All right, and then the last thing we're gonna touch on here is repeat breedings. People often ask, should we breed on back-to-back cycles? Is it okay to breed on back-to-back cycles? And my rule of thumb is if that bitch has had no health problems during her lactation, she didn't have mastitis, she didn't have a uterine infection, she didn't bleed more than 8 weeks postpartum, so that's a SIPS-like condition, subinvolution of the placental sites, or have any other type of illness associated with her pregnancy or lactation. She didn't have pregnancy toxemia or gestational diabetes before she got pregnant, and she regains her body condition within 1 month of weaning. So that's when puppies are fully removed. Then breeding on back-to-back cycles is perfectly fine. Pregnancy is more protective of uterine health than an open cycle is. Open cycles are more of an opportunity for pathology to develop. So in terms of the bitch's fertility, it's going to be better to breed on back-to-back cycles, but there are lots of reasons why we don't breed on back-to-back cycles in terms of just our lifestyles and things that we have planned. Sometimes what breed clubs require that you have to take, you can breed 2 back-to-back, but then you have to take a cycle off. The illnesses and body condition are the main reasons that I think that we shouldn't breed on back-to-backs. And then when to spay our intact breeding, our brood bitches. I think that all bitches should be spayed as soon as they're done being bred. And there's, a few caveats now with certain breeds where we know that there are some benefits to keeping them intact longer. Golden Retriever females would be the big one there, where we know that there's some benefit to reducing cancer risk by keeping them intact longer. But at some point, almost every bitch, regardless of her breed, is going to start to be at much higher risk of developing a pyometra or mammary cancer. And trading one type of cancer for another type of cancer, I think is, potentially not the best decision-making process that we're doing. So, and I would much rather spay a bitch that is healthy than a bitch that has a pyometra, because I have greater chance that she's going to survive her surgery. So I think that as they get older, even for our breeds where there's some benefit to leaving them intact longer, like the Golden Retriever female, we still kind of reach a point where spaying them is going to be the safer outcome for that bitch in the long term. About 25% of bitches that aren't spayed will develop a pyometra, which is a pretty high percentage and much higher than the percentage of those bitches that are going to develop hemangiosarc or osteosarc. And then the last thing is spaying with C-sections. People ask us a lot if we can spay the bitch at the time of C-section, and we don't generally do that in our practice. For a number of reasons. One, there's an increased risk of postoperative hemorrhage, and that can cause the bitch to be hypotensive during anesthesia, which increases our risks of her surviving surgery. The bitch does share about a third of her blood volume with the fetuses and the gravid uterus, the placentas. So removing that uterus is taking a fourth of her blood away in one fell swoop, and that can also make them hypotensive in surgery and increase our anesthetic risk. The hypotension that's associated with that rapid blood loss slows the bitch's recovery time down post-operatively. And bitches in late pregnancy are what we call thromboembolic. They are better at making clots. And that's because when the placentas come off, they have to, all those little blood vessels that are in the placentas have to seal up very quickly. And so there's an increased risk when we are tying off a lot of blood vessels during the spay that one of those clots that will form will break off and go to either the brain or the lung, and then we'll have an acute death in the 24 to 48 hours post surgery. And so for these reasons, we don't recommend doing spays at the time of surgery unless there's something physically wrong with the uterus that we can't correct, and then we have to do the spay. And that's the end of the talk. My favorite puppy pictures are upside down puppies. So my clients send me upside down puppy pictures all the time. And I'll take any questions.
Amazing. I love that photo as well. It's so cute. Okay, we do have a few questions. One of them, following what you just mentioned about back-to-back breedings, does the same also apply to C-sections?
Yeah, I think that I mean the bitch heals from a C-section really quite quickly. And so the uterus is completely healed within about 2 weeks. The body wall is going to take a couple of months to heal, but well before we're going to be doing the next C-section, everything will be fully healed. So I don't have any qualms about doing back-to-back C-sections.
Amazing. And I think you might have mentioned this, but someone had asked, and I was wondering if we could summarize, what's the maximum number of times you can breed a bitch without compromising the health of the bitch and the puppies?
Well, I am so it's a difficult question. So I think that probably the better question is if you're doing a good job with your breeding selection, how many times do you need to breed a bitch to get the genetics out of her that you want to advance your breeding program. Because realistically, what we're all trying to do is to make better and healthier puppies. So if I am doing a good job with selecting my males, and then I'm getting puppies out of these litters that are improvements on both the sire and the dam, then that's the genetics that I really want to push forward in my breeding program. So how many litters till I have like proven that either this bitch is gonna produce well for me, or she is not a producer and I shouldn't be breeding her because she's not really doing anything to improve the breed. And I think that in 3 or 4 litters, if you've done a good job with your stud selection, you will know whether that bitch is producing and you've held a puppy or 2 back, or you've put them in homes where you have breeding rights to them. And you can now stop breeding that bitch and move on. Every time that we breed a bitch, we put a physiologic strain on all of her organ systems, but particularly the kidneys. Because with every pregnancy, we take a third of the blood supply away from the kidneys for about 45 days. And that stress on the kidneys will eventually, or potentially, will cause them to have renal dysfunction as they get older. And so I think that to, protect the bitch's health as she ages, we really shouldn't be breeding bitches, 4 times, 5 times would be the absolute maximum. And I don't think that really, 3 or 4 times is probably what I tell people you should aim for a bitch that is a really good brood bitch. Like, this bitch is really producing well. I'm getting something out of every litter that I want to keep back for my breeding program to improve the breed. You get 2 or 3 litters and that bitch hasn't produced anything for you, stop breeding her and move on to something else.
Thank you for such a great answer to such a difficult question. That was amazing. Okay, I think we have time for 2 more questions that came in from our live viewers. So someone is wondering about canine herpes virus. My girl is due in 3 weeks and is negative for canine herpes virus antibodies. What can I do to prevent CHV besides isolation?
Well, probably nothing other than prevent exposure. Just because she's negative on her herpes titer does not mean that she does not have herpes virus or that she's been exposed to herpes virus, because titers are really only high for about 2 weeks after an exposure, and then they go back to baseline. So it's very difficult to determine whether your bitch has been exposed to herpes or has herpes during pregnancy or her early postpartum period, by titering them. It's not something that we routinely do to assess herpes risk. And so, herpes is a ubiquitous virus. It's every place. If your dog goes to dog shows, dog events, dog park, walks where other dogs walk, is nose to nose with other dogs ever, the chance that she will have an exposure is high. And so the goal is to recognize it and minimize her exposure during the critical period of pregnancy and the first 3 weeks of lactation. So I think just keeping her away from other dogs, keeping other dogs in your house away from other dogs, because if you keep her at home, but you take another dog to the dog show and then you come home, if your dog that went to the dog show breathed the air that had herpes virus in it, you've just brought herpes virus into your house. So not taking any of your dogs or not going to high risk places is going to reduce their risk. And then just being aware of the symptoms that we see in puppies that have herpes virus, vocalizing, fading, usually respiratory symptoms, are the common symptoms that we see in the first 2 weeks postpartum. Recognizing that quickly, and then, you know, involving your veterinarian in the care of them to try to reduce the replication of the virus in the puppies if they do get exposed.
Amazing. Thank you for answering that one so thoroughly. Okay, I think we have time for one last question. I think this is from Kelly Curry, who's wondering, are you a fan of the Delay style suction? I don't know if I pronounced that correctly.
Yeah, delay mucus trap. I'm not. So the delay mucus trap is basically something that you use to empty the stomach of all of the contents, so that when you're resuscitating puppies, you're getting, you know, any fluid that's coming out of their stomach, so that when you're, you know, rubbing them, you're not continuously pushing that fluid up out of their stomach, especially if they're not resuscitating well and their esophageal sphincter is very relaxed. That fluid keeps coming up. But we tend to, like, I tend to, when I resuscitate puppies, to keep their heads pointed down when I'm resuscitating until they are really vocalizing well and they're starting to move around a lot. Because at that point in time, their upper esophageal sphincter closes and anything that's left in their stomach is going to stay in their stomach. So I'm not opposed to its use, but I think, like, a lot of people think that when they put that in, that they're getting fluid from the puppy's lungs, which you are not. It's going into the puppy's stomach, and you're getting mucus out of the puppy's stomach, the amniotic fluid that puppy's been drinking. So I don't think there's anything wrong with using it, but it's just one more thing that you have to, like, be doing to a puppy rather than stimulating it, because you can't stimulate it while you're putting the mucus trap down it and suctioning them. So I prefer to be active in my stimulation of puppies when I'm resuscitating and spend less time having them lay on a table doing nothing while I'm trying to empty their stomach, when I can do that just by holding their heads down and just letting the fluid spill out of them, and then suction their mouth as we get fluid coming.
Really interesting. I had no idea what that was. So thank you for going over that. I think that's all of the questions we have. Thank you, Dr. Lopate, so much for coming back to join us for part 2 of this presentation. This was amazing. I'm already seeing so many people in the chat feed saying that they love this presentation and it was awesome. So we just couldn't thank you enough for taking the time to do this for our community.
Yeah, great. Thanks for having me.
Of course. And thank you so much to our audience for joining us, for asking such wonderful questions, for sharing such great thoughts. If you're not yet a member of our community, you can apply to join at gooddog.com/join, so you can stay up to date on all of our future events that are coming up. And just to give a preview of what some of those events are, we have what I believe is our final educational webinar for 2024, which is crazy. I feel like the year has flown by. That's going to be must-have whelping supplies for your breeding kennel. And it's going to be on December 4th at 1 p.m. Eastern with Dr. Andrea Hesser, who we've had on a few times this year already. So we'll be sharing much more information about that in the coming weeks, and RSVP links, all of that good stuff. I just wanted to give everyone a preview for that. And then, unrelated to education, we did announce that we're having our 6th annual Breeder Appreciation virtual holiday party on December 11th at 7 p.m. Eastern. So we're going to quickly drop a link in the chat to RSVP for that if you haven't done so already. If you don't know what that is, it's just a really great way for us to end the year with our community. We have tons of giveaways. It's entirely virtual, so you can join from anywhere. And it's really fun. If you've been there before, you know it's one of our highlights of the year. So I definitely encourage everyone to RSVP and join us for that. And until then, I hope everyone has a fantastic rest of their day, rest of their night, depending on where you're joining from. And we will see you again at our next webinar. Bye, everyone. Thank you, Dr. Lopate.
Yeah, thank
Bye.
you. Bye.